Now, of course, the biotech industry is what we're really talking about, and I can think of no better person to tell you about the biotech industry than our very own Professor Robert Langer from the Chemical Engineering Department. I should say that I really am in no position to introduce Bob because of his extraordinary accomplishments. So I apologize for my introducing you, Bob. But just to give you a sense of his accomplishments, he's been called the Thomas Edison of the biopharma industry. That's actually a bit of a slight to Bob, because Thomas Edison in his lifetime only produced 1,094 patents. And currently, as of last count, I think, Bob, your patent count is 1,134 and counting. Also, Bob is the most highly cited engineer in the history of academia, which is an extraordinary accomplishment. He's an institute professor. There are only 13 such professors at MIT. These professorships are unusual in the sense that they report directly to the president. They are not part of any department. There's no teaching responsibilities. In fact, these professorships are for extraordinarily accomplished individuals. Despite the fact that Bob has no obligations whatsoever, he does serve on committees. He and I are on the Whitehead board, so we've been on committees together. And despite the fact that he has no teaching responsibilities, he graciously agrees to lecture at classes of all of his colleagues who ask him. And believe me, many of us ask him. So in addition to that, he has started over 35 companies. And let me tell you, his hit rate is a lot higher than anything I've ever seen in the industry. So this is an extraordinary individual and one that I think you will really enjoy hearing from. So with that, please join me in welcoming Professor Robert Langer.
Well, thank you. It's really a pleasure and actually great to hear. Royalty Pharma is just a wonderful example of what can be done and really helping the biotech industry. I'm going to do something very different. I'm going to tell you a little bit about my career and then how we started companies. And by the way, it's not all so pretty and straightforward either, and you'll see that as I go through. So a little bit about me beyond what Andrew said. When I actually got my degree in 1974 from here in chemical engineering. And when I got done, the most common thing for a chemical engineer to do was to go into the oil industry. There was, just like a few years ago, there was this gas shortage, and so the prices kept going up and up. And in fact, if you had a car in Cambridge, you actually had to wait in line for 2 hours to get your tank filled up. But if you were a chemical engineer, you got a lot of job offers. And so all my friends pretty much went to the oil industry, so I thought I'd do that too. And actually, I got 20 job offers, 4 from Exxon alone. But I wasn't very excited about it, and I started to look into other things. And one of the things I did when I was a graduate student is I helped start a school for poor kids in Cambridge, and I got very involved in developing new chemistry curricula. And one day I saw an ad to be an assistant professor to do just that at City College in New York. And I wrote them a letter applying for a job, but they didn't write me back. But I really liked the idea, so I found all the ads I could to be assistant professor to do chemistry education. I found about 40, and I wrote all of them, and none of them wrote me back. I wasn't, I guess, in the right box. So I thought, what other way could I use my chemical engineering education to help people? And I thought about medicine. So I wrote to a lot of hospitals and medical schools, and they didn't write back either. And then one day, one of the people in my lab said, Bob, he said, there's a surgeon in Boston named Judah Folkman. And he said, sometimes he hires unusual people. He thought very highly of Dr. Folkman. I won't say what he thought about me. And Dr. Folkman, the problem he was trying to figure out was he had a theory that if you could stop blood vessels from growing, you could stop cancer. And my job, he said, was to prove that theory, and in so doing, really find the first substance that would stop blood vessels from growing. And to do that, what we had to do is to create a bioassay. And to create that bioassay, what we had to do is put these, what we call blood vessel inhibitors, in the body. And we had to have a way to deliver them. We had to have a way to deliver them in what I'll call an unaltered form for a long time, like at least 2 months. And these molecules, by the way, that we were dealing with, they were big molecules, exactly the types that Pablo was just mentioning. And nobody had ever done that before. People felt that you couldn't use a polymer, that's what we were trying to use, to release anything in very small molecules. But to me, it was essential to solve this problem. So, and actually, I sometimes say the only thing I had going for me is I hadn't read stuff like this. So I tried anyhow. I actually spent 2 years in the laboratory experimenting with different techniques, and I found actually over 200 ways to get this to not work. But eventually I was able to make little microspheres. Here's one cut in half. And we published in the journal Nature in 1976 that you could release molecules of any size for over 100 days. And you know, one of the things that's common in science is you get asked to give talks. So in 1976, 2 years after I started, I got asked to give this talk at a big polymer meeting. And I'd never really given a talk before except in 8th grade. And that didn't go real well. In 8th grade, I had to give this minute-and-a-half speech. I practiced it for 3 hours the night before in front of my parents' mirror. And I got up in front of the class the next day, and I started reciting it from memory. And actually, for the first minute, I did okay. And then I couldn't remember the next word. And I stood up there frozen in front of my 8th grade class for another minute until the teacher finally told me to sit down and gave me a not very good grade. It was an F. So ever after that, I was very nervous about these things. And now when this big talk came many years later, I actually stopped work 2 weeks in advance of the talk. I kept practicing it into a tape recorder for hours and hours. And finally the day came, I gave the talk. Yeah, I was 27 years old. And there were very distinguished polymer chemists and engineers in the audience. And actually, this time I did better than in 8th grade. I didn't forget too much what I was going to say. I didn't stammer too much. And I thought when I was done with this talk that all these engineers and chemists, being nice people, would want to encourage me, this young guy. And when I got done, I stepped off the podium, and a whole bunch of them came up to me, and they said, "We don't believe anything you just said." You know, went against conventional wisdom. And actually, what they said is that a large molecule, like I said before, can't diffuse through a solid polymer any more than, say, one of us could walk through a wall. We're also using organic solvents, and people said that would destroy whatever we would put in, especially for these large molecules. So, and then, this was 1976, things kind of went downhill from there. So one of the things, I was a postdoc, as I mentioned, and I really liked it. It was an exciting job, and we did actually isolate the first angiogenesis inhibitor with the work I'm going to tell you about, and publish this in Science, which would pave the way for many of the drugs that Pablo just talked about. Actually, number 7 on his list is Avastin, and it used to be higher up. Even, I think at one point it was number 1 or 2. And that's based on this paper we published in Science in 1976, which was the first one. But anyhow, going back to being a postdoc, so a lot of my friends said, "Bob, you know, being a postdoc your whole life, that's probably not good. So you should apply for faculty positions." So I did. I applied to faculty positions, and I was a chemical engineer. Not a single chemical engineering department in the United States would hire me. They said, "This bio stuff you're doing, it doesn't make any sense." So I ended up getting a job in a nutrition department here. By the way, also, the first 9 grants that I wrote, everyone got rejected. But anyhow, I ended up getting a job in the nutrition department here. And what happened then, this was actually before Andrew's time, I think, but the man's name was Nevin Scrimshaw. And he was he was very famous. He was an institute professor too. And but he was kind of what I'd call a benevolent dictator. Meaning that what he did is he didn't care what the rest of the department thought. He wanted to hire me, so he did. The only problem was the year after he hired me, he left. And so then what happened is a lot of the senior faculty started to give me advice. And their advice pretty much is I should start looking for a new job. And to that end, I had a good friend, Mike Marletta. He's now a member of the National Academy of Science. He's been president of Scripps and other things. And this was just from actually a biotech award I got a couple of years ago, and he was giving a speech, and I'll just read you that speech. This is just part of it. But he said, one evening, this is now referring back to 1980 or so, he said, "One evening I went to a faculty dinner at a Chinese restaurant with myself and some senior MIT professors. He said, a senior scientist sat quizzing us while smoking a cigar. When the older scientist heard my concepts for polymeric drug delivery, he blew a cloud of smoke in my face and said, 'You better start looking for another job.' And Mike said he thought he was in a Fellini movie." But you know, the key thing in science is ultimately people repeating what you do. And fortunately for me, that would happen in academics. A lot of people, as Andrew mentioned, kept citing our work and using it in academics. I think now there's 225,000 citations. But at any rate, so that was good, but still people would start to criticize me and they'd say, well, but how could this possibly work? You know, it didn't understand it. So I had a student, Rajan Bawa, for his thesis, we started to look at the mechanism. We'd cut thin sections through the polymer. And if you didn't have a drug in it, you had like the sheet, and a molecule couldn't go from one side to the other. But what we discovered is that if you put a protein in it, and then you released it for a couple years, and then you cut a thin section, what you saw is left behind where the drug was are these pores. They weren't there before. And actually, we did a lot of image analysis, and it turns out that these pores are large enough so that molecules, even millions of molecular weight, can get through. But it also turns out, when you do the image analysis, that they have tight constrictions between them, and they're incredibly winding and tortuous. So it takes a really long time for the molecules to get through. I often explain this to people as like driving a car through Boston. There's a term we use in chemical engineering called tortuosity. And I would say Boston and these systems have very high tortuosity. And over the years, our students did theses where they basically developed all the rules and mathematical models for how you could predict these pore structures and design these systems so you could get release anywhere from a day to many years or any time in between. Now, one of the things that also happened was that Dr. Folkman said to me, you know, and this is today, patenting may seem obvious, but he said to me, you know, we should file a patent. Boston Children's Hospital in the 1970s never had a patent in their entire history, and it's probably the best children's hospital in the world. So we filed a patent. 5 years in a row, the patent examiner turned it down. And the lawyer for the hospital said, Bob, you should just give up. The guy doesn't get it. He's never going to allow it. But I don't like to give up. And I started to think, you know, we were trying to explain to the patent examiner science that wasn't working very well. But I started to think, you know, how could we convince this examiner to allow the patent, you know, legally, of course. And I started to think, you know, all these people told me we could never do this and that it was impossible. I wondered if anybody wrote that down. So you can do what we call a science citation search, where in 1982, I looked back at our 1976 Nature paper and saw who wrote different things about it. And I found a lot of great quotes. Here's one. This is from 5 of the top polymer chemists of the world. Here's what they wrote. They wrote, generally the agent to be released is a relatively small molecule with a molecular weight no larger than a few hundred. One would not expect macromolecules, for example, proteins, could be released by such a technique because of their extremely small permeation rates through polymers. However, Folkman and myself have reported some surprising, so that's a really good word for a patent examiner, results that clearly demonstrate the opposite. So I showed this to the lawyer. He was very excited. He flew down to Washington to show it to the examiner. And the examiner said, I had no idea. He said, I tell you what, I will allow this patent if Dr. Langer can get written affidavits from each of these 5 people that they really wrote this. So it's true story. So I wrote each of them, and all of them were nice enough to write me back. I was just this young guy, that they really did write it. And we got this very, very broad patent on pretty much any polymer and in any molecule that was fairly large. So then what happened is, and I think I'll turn this off for just a second. So then what happened was, you know, I'd been working on this stuff probably for about 10 years, and now people were using it academically. But I really wanted it to go out to the world, to get used by people. And that wasn't happening. So finally, in 1983, I got a call, this was 9 years after I started, from a multi-billion-dollar animal health company, IMC. And they said, we'd like you to consult for us. We want to deliver animal growth hormones. We can't do it. Would you help us? And I said, sure. And they gave me a consulting fee. By the way, I had a Ford Pinto. It was falling apart at the time. And I got a much better car. And then they gave me a big grant, $200,000 a year, which for a young professor at that time was huge. And most exciting to me is they were going to work on it. Next year, Eli Lilly, you've heard of Eli Lilly, big company, they said, we want you to consult for us. We want to deliver insulin. And I said, we're going to give you another consulting fee, and we'll give you another $200,000 grant, and we're going to work on it. I thought, this is fantastic. The only thing is that, you know, those large companies, they do a couple of experiments a year, and then they'd give up. And that really made me very sad. I got happy about the car, but, you know, I was unhappy that that was happening. And so what happened was, you know, about 2 years later, Alex Klebanoff, he's a professor in chemistry, he's a very close friend of mine, he said, Bob, he said, we should start a company. And I got the patents back. We started this little company, and the first 4 employees, called Enzytech, and basically with the microspheres. First 4 employees were my students. And what happened is we had, I think, a good technology, it was working, but we didn't have a great CEO. We were on the 5th floor of a building on Sydney Street. On the 4th floor, there was another company called Alkermes, and they were in exactly the opposite situation. They had a technology that wasn't working, but they had a very good CEO, Rich Pops. So anyhow, we decided to do this merger. Today, that company, Alkermes, if you look at it, it's worth about $9 billion. If you look at it in the stock market, 25 products that are FDA approved in clinical trials, and millions of patients benefit from their products, which treat schizophrenia, alcoholism, narcotic addiction, diabetes. They have 1,750 employees. I'll just tell you a few other stories quickly. We've done, actually, at Harvard Business Review, 40 companies. But I'll just tell a couple more. And Terry, who I have done most of them with, Terry actually says, you know, there's a player and a coach, and so I guess I'm the player, and he's been a fantastic coach. But anyhow, the second one, I'll do these next couple just quickly. And I've always done these with my students. I think I've loved that, and the students really have this dream to start these companies. So here, 2 of my students, Ram Sesascaran was still here at MIT, he's a chaired professor, he was head of HST at one point, and Ganesh Venkatraman. And Polaris was the initial funder. We got several rounds of venture capital, went public in 2004, and then we kept doing deals with different people like Novartis and Baxter and Mylan and CSL. And what was really exciting, see here what we did, here we came up with a technology. I had isolated, even when I was a young professor, certain enzymes that could cut complex sugars like heparins or things like that. And Ram and Ganesh then went further and actually figured out the first ways to sequence complex polysaccharides. In other words, if you try to sequence DNA, that's not easy, but it had been done. If you try to sequence proteins, that's not easy, but it had been done. We figured out the first ways to sequence now complex polysaccharides, Ram and Ganesh, and that was a paper in Science. All these papers were actually in Science, with the journal. And so we had a way of combining scientifically these molecular scissors, which were the enzymes we'd isolated, mass spec, and then computer modeling. And with that, we could sequence almost anything. And what was amazing about this is there were a lot larger companies like Teva and others who were trying to make low molecular weight heparins. And if you looked at the analyst reports, they would say that those companies, you know, were way ahead of us, but they were wrong. Basically, we had this tiny company, and Lovenox, which was a multi-billion-dollar drug, was approved by the FDA with Momenta in 2010. First complex drug ever approved based on analytic data. It was over $1 billion of sales in the first year. It was the largest syringe launch in history. And Copaxone, that's another complex molecule, that was approved in 2005. If you look, this is the product, and of course the company did well when that happened. But I wanted to tell you one other story, which I think is also the good that can come out of these kinds of technologies. In 2008, people probably don't remember this, perhaps they're too young, but in 2008 there was this really awful crisis. People were dying, actually it spread to 22 countries, of contaminated heparin from China. And I had been head of the FDA Science Board, that's their top advisory board, so they knew me and they knew Ram. And so they called us up. What you see with these headlines is tainted heparin, it just keeps going on and on, but ultimately it's 22 countries, hundreds of deaths, and they didn't know why. So they said, could we help them figure it out? So what we did, and this was really unprecedented, is Ram and us at MIT, Momenta, the company, and the FDA and the CDC, we worked together, and we published these 3 papers. First, we identified the contaminant, which in the heparin, which is oversulfated chondroitin sulfate, that was in Nature. Secondly, 2 papers, both with the FDA and the CDC, Momenta and MIT, in the New England Journal of Medicine. And after this, there were no more deaths. The next example is a very recent one, but it really, again, illustrates what we like to do with our students. There's a lot of ways that you can get things into cells. That's an exciting area. Some of them are shown here. You can use electricity and do electroporation, but that can cause damage. You can have cell-penetrating peptides. That pokes holes in a cell, but that also can cause harm. You can even have nanoparticles, which we do a lot with, but that has off-target effects. And so basically, I had a student, Armin Shari. Armin had got his undergraduate degree at Stanford, and then he came to do his PhD with me and Klaus Jensen, who at that time was head of the chemie department. And we decided we'd look at new ways of trying to get things to enter cells. And one of the things that Armin started to do was to use what we call a gun to try to poke holes in the cell. But our idea was that we would put the cells through what we call a microfluidic chamber and then shoot at it. Here's a video. And what was striking as Armin did it, and it was really serendipitous, here's the gun, is it turns out you don't need the gun because the cell goes through this constriction, it's squeezed. And as I'll show you, that has a remarkable effect. You can put 1 million cells through this, and when you do it, things will enter the cells, like genes or whatever you want. And here's an example. We took 4 transcription factors, and we tried to see whether we could make iPS cells. That's a certain type of stem cell that people would like to make. It won the Nobel Prize a few years ago. But if you use a cell-penetrating peptide, you get like 2 colonies. Nucleofection, that's the electricity method, that's 11. But when you do the reprogramming with the squeeze approach, we got 150. And in 2014, Scientific American came out with their top 10 advances of 2013. CRISPR, Cas9 finished first. This finished second. I felt they had the order wrong, but you take what you can. And but still, it was a significant breakthrough. And we've done this now with about 30 different cell lines, and all different kinds of molecules can be put in. Also, one of the other things that's interesting is it's much milder and safer. Here's like what's called the transcriptome. That's what's called your messenger RNA of a cell. And if you looked at a gel, looking at your messenger RNA, a control looks like this. Electroporation really changes it. The squeeze method changes it a little, but not that much. So it's actually, and you'll see the same thing with cell death. So what we did again, Armin started doing a postdoc, and then one day he wanted to see me. He said, he was confused about what to do. I said, well, what's your dream? And he said, my dream is to get this out to the world to start a company. So I said, you should go for it. And what happened is Armin is now the CEO. Howard Bernstein, another one of my former students who'd worked at several of our companies and has already been elected to the National Academy of Engineering, is the chief scientific officer. He's had about 20, he's an MD, PhD, and he's had a lot of experience. And then one of Terry's partners, Amy Schulman, who was chief counsel at Pfizer, and she's a fantastic mentor, has been great with Armin. Armin's charismatic, he's visionary, and he can sell. But it's great because Amy, really coaches him on what to do. So they've been a fantastic team. And Polaris did the initial funding. And then they already got a $500 million deal with Huffman LaRoche to engineer B cells. So I thought I'd just give you one more company, which is a little bit different. We've done a lot of stuff, almost all in medicine. But one day, some of Terry's partners came to see me, one of whom is my own student, Amir Nishat, who's a partner at Polaris, and then John Flynn, his other partner. He said, Bob, we've given you all this money to start these medical companies. He said, we had an idea. We wonder if you could help us start a hair company. Now, that might seem unusual, but I felt that they were, great partners, and I thought, well, let's see what we can do. So we actually took a look at this. And, hair is kind of amazing. One of the things that I said, well, what kind of products might you be interested in? In fact, they even got us some very good hairstylists to come in. They said, well, one of the big problems is a lot of people get frizzy hair. I probably, by the way, get frizzy hair. So they said, can you do something better? So we actually looked at this. There are probably 50 different companies making anti-frizz products. And did you know that every single one of them uses the exact same ingredient, silicone oil? Exactly the same ingredient. They formulate it a little differently, but it's still the same ingredient. So Dan Anderson, who was one of my postdocs then, he's now a professor at MIT, and I and some of the people that we'd hired who are also some of my former students, we said, well, let's take a more fundamental look at it. What causes frizz in the first place? And what's the problem? Well, the problem, as you probably know, is humidity. So if you think about it, how would you stop frizz if you wanted to take some fundamental look at it? So what we thought is, well, you want to keep humidity out. So you want something that they call in chemistry hydrophobic, water repellent. Silicone's somewhat hydrophobic, but it's not that hydrophobic. It really doesn't fight humidity very well. And so we started, so I'll just ask you this question. If you started thinking about it fundamentally, what can you think of that's really water repellent, that's really hydrophobic? Well, in the interest of time, I'll tell you our answer. Teflon frying pan, right? That's super hydrophobic. That's a polyfluoroester. So, of course, we're not going to put Teflon frying pans in your hair, but we said, is there anything in use that's a polyfluoroester that's safe? Turns out that people coat certain intraocular lenses with a certain polyfluoroester. And so we looked at that structure, the chemical structure, thought it ought to work well. We tried it in these simple things, and we call it no frizz, but it's a polyfluoroester. And you can see a huge difference, especially when you compare it to the silicone. And so what we did is we made a whole line of these. And it's also very, very light on your hair and stuff like that. It's very popular. In fact, my daughter Susan, who's in the audience, even worked there for her first job in the summer. Anyhow, but it worked really well. I'm going to show you a video to illustrate it more. This is from a TV show.
Better to seek out today's leading edge of invention? It's a complete no-brainer. MIT.
We've done a lot of work on new kinds of implants to treat brain cancer, to treat different kinds of cancer and other diseases.
Bob Langer and Dan Anderson run one of the biggest academic research labs in the country. Langer alone has over 750 medical patents, more than anyone in the world. He and Anderson have had amazing success inventing novel medical materials and life-saving therapeutics.
Well, certainly it's one of the reasons I really like my job. I mean, you know, you really feel like the work you're doing on a day-to-day is not only scientifically interesting, but also can have a real impact on people's lives.
Now, their work on stem cells and damaged spinal cords has had to make way for another vexing problem. Bad hair days. The result? No Frizz. Based on Anderson and Langer's science, No Frizz has taken the beauty world by storm.
It's so amazing that the big companies haven't been able to solve these problems in such a short time. We've been able to really tackle problems that have really dramatically affected women for many years.
Rob Robillard is CEO of Living Proof, makers of No Frizz. This Cambridge startup secret weapon, science. Using renowned researchers from outside the beauty industry to apply new thinking to age-old problems.
This side of her head was treated with one of those silicone products. This side was styled with No Frizz technology.
We found the holy grail for Frizz. It's amazing.
Noted stylist Mitch DeRosa is a co-founder of Living Proof. He says until now, the fight against Frizz has relied on silicone-based products, which keep moisture out, but can leave hair heavy and greasy. Along come Anderson and Langer and their discovery of polyfluoroester.
This creates a weightless shield sheathed around each hair fiber.
For Langer and Anderson, there's nothing trivial about their work for a beauty product. After all, they consider themselves equal opportunity problem solvers.
Do your fellow professors give you teach you sometimes about the Frizzies, or they have a fun with it, or they?
A lot of them use it.
So that was the first line of products, but then I asked, what else would you like? And they said, well, can we make hair fuller? So one of the things Dan had done is we had created a polymer library. The goal was gene therapy, but the library of polymers, it's literally thousands of polymers where we had broad composition of matter patents. And so what we did is we did sort of high throughput studies. We found one of those, not one that was used for gene therapy, but another that gave hair a lot more body. And this is an example of that. And here it is on the shelf. But you know, I thought I'd share a lesson with you I learned that, you know, in medicine, if you have a great product, you know, I think people will use it by and large. And that's happened with us overall. Here it's very different. With the company, you know, after a few years, they hired a very smart vice president of marketing who went to Harvard Business School, Grace Ray. And she did this analysis. She said, you know, 95% of the women who use this like it. 95% of the women who use it reuse it. And she said maybe less than 1% of the people know it exists. So, you know, so what turns out is in cosmetics, it's very different. So what they did, though, is the business people at the company are very smart. They said, well, we'll get somebody involved maybe that people will know it and recognize. And they got this young woman. That's me, that's her. And she got involved in it, and she was great. And so anyhow, if people followed this story, Unilever bought it for quite a bit in December or January. But we also, and people may have seen this in the MIT newspaper, one of the other things we invented while we were doing this stuff is another question I'd ask them is they'd want to come up with ways to tighten skin. So we actually came up with something, and this is another one of my students did this, Betty Yu, who was in charge of the skin part. And then Unilever didn't buy that part. That's called Olivo. And just to tell you what the second skin did, that is something, it's a polymer formulation we came up with. We've actually published this in Nature Materials too, but it was all over, like the New York Times, everywhere. We did this with Rox Anderson and people at the company. And basically, just to show you what happens, is this is a woman, you know, with under eye thing. You put the product on, and the wrinkles will go away. And it's not limited to just the eye area. You know, it's kind of almost like a liquid Spanx. That's the way it works. So it can tighten up a lot of other things. So actually, we spun that out. Amy Schulman, who I mentioned before, is the executive chair of that too. And you can also use it for dermatology. And in fact, that's one of the things that the dermatologists like Rox Anderson are particularly excited about. Because normally, if you put a cream on, you lose 95%. Here, you lose nothing because you put it on as a cream and it hardens right away. I thought I'd just make a couple summary comments. First on the science, you know, which is what I do. So we've done 40 companies. I think as Harvard Business Review said, 39 are still around in one form or another. Every time it's really been a platform technology. In other words, we can make different kinds of products using the same technology, like the microspheres. You could put drug A in it, drug B in it, drug C in it, so you could do deals with Pfizer, Merck, Lilly, so forth. It maximizes the use of the products. Also, they're product companies. Every time, and I've really emphasized this, of course, this is maybe me being an academician, but we've published this stuff usually first in the best journals in the world, Science or Nature. And we have continued to urge the companies to do the same. We tie those papers to really powerful blocking patents like the one I showed you. But we've done this for every company. In other words, one thing is to have a patent, and you know, Pablo talked about this some too, and the reason patents are so important is that's key to the investment, it's key to the sales. So you can have what's called freedom to operate, that's good. But even better is if you have a blocking patent that prevents other people from being able to do anything. And that may sound mean, but if you want to get enough money to develop these products, you need great patents. Also, in medicine, you generally want an in vivo proof of principle because the road is long. I'm sure Terry will tell you that. The road from the research that we do to having a product, it's a long road. And every time we've done it, I've done it with my current or former students. I've done it because that's been their dream, but I also do it. I would also say it's had the added advantage of having real champions in the company. One of the things that happened, I think, when I look back at the Eli Lilly and IMC experiences, you know, those are great companies, but they didn't have the passion, you know, any more than the people that took over from Steve Jobs at Apple had the passion. They didn't create these things, whereas the people in the lab, they did. You know, and they're going to walk through walls like Armin and others, Ganesh, to make sure that their things work. So those are some principles. But those are on a science sort of side. And I was going to tie that to a few other things in general. Some of the times, and Terry's going to mention some examples on this, you can come up with regulatory strategies, FDA strategies that'll get faster approval. For example, one thing we did, and I think he's going to talk about this, is we came up with a way to change the geometry of an aerosol. But that's not changing the chemistry, so the safety is pretty clear. So you can get much more rapid approval. Also, and I've alluded to this before, you want a great management team, particularly a CEO. You want wise, patient investors. That's such a key to have people like Terry, places like that, that really understand that the road is long, but that you can create great value even without sales for a while. And people will keep investing because those sales will come. I also think if you come up, and we're very involved in these, I didn't put those companies down, but if you have novel therapeutics, I think Terry's going to mention one of them, but if you come up with novel therapeutics like siRNA or mRNA, you want to choose clinical indications where delivery is easy, because delivery is hard. You want to create a great culture, and you want to use advisory boards well. So that's what I wanted to say. Pleasure to talk to you all. Thank you.
So now you see why we were so delighted to have Bob with us. The incredible progress of the biotech industry and what Pablo showed on the graph in 2015 of the top companies, a significant part of that progress is actually due to Bob, his lab, and his colleagues. In fact, a number of the cancer drugs are actually based upon ideas that Bob developed, in addition to many of the other technologies that he didn't have time to talk about. So I urge you all to take a look at his website and to take a look at the readings that we have about the Langer Lab.